Hi, my name is John Bosworth. I'm a licensed mental health counselor in St. Pete, Florida. I'd like to talk a little bit about treating ADD or ADHD. Treating ADD is not real simple. Basically, we have a couple areas that we want to look at. In, in, in the process of it, what we want to recognize is that there's no cure for it. So what we really want to do is more of a symptom management. And by symptom management, what we want to do is address a couple different areas. We want to look at medications. Okay, there are certain stimulant medications that actually help the person with ADD to focus or to have a better memory or better concentration skills. So we can, from a medication standpoint, we can help the person deal with some of the, the distractibility that they have without, without some type of psychostimulant in their system. And then what we want to do is, if the medication is right, we want to experiment with different medications that work. There are some side effects, and we won't go into that now, but we will have the medical professional or the pediatrician make sure that that the drug or the medication is right for that person. So we'll try different things until we find what works based on side effects. And then, from my perspective, what I do as a mental health professional, I look at and try to recommend family counseling for the individual. And family counseling, from a systems perspective, just likes to look at ways that we can encourage and incorporate better coping skills within the whole family and not just with the individual affected with ADD. Also, from a counseling standpoint, individual counseling can be very, very effective, and that's basically what I specialize in that we can show the person with attention deficit problems how to manage some practical things such as attention, along with their medication and focusing and task orientation. But we can also teach them ways to accept themselves with their disorder without making it a big deal and making their life or the rest of their life miserable because they have ADD. And also, the last thing I like to look at is schools can help by developing plans and educating teachers how the best, as to the best methods for going about helping students in the classroom or even adults in the work setting that, that deal with attention deficit or attention deficit hyperactivity problems. What we want to do is kind of what I call a multimodal approach. And again, I want to review it real quick. It's medication, family therapy, individual therapy can be helpful, school support, and an overall medical assessment of the person and making sure that no other biological influences interfere. My name's John Bosworth, and we're looking at how to treat ADHD.